Well, we have been focusing a lot on the Kerala gold scam case, but right now the figures coming out of Kerala with regard to the COVID numbers are actually quite startling. It happens to be the state with the highest number of active cases per 10 lakh population, with 2,241 cases per 10 lakh population. The state also has the maximum number of new cases in the country with 1,599 per 10 lakh population. This surpasses states like Maharashtra, Delhi and Karnataka. Health experts in Kerala believe that the state will hit its COVID peak in the next 2 weeks. The biggest concern in the state is inadequate trained manpower. As a result, there is excess pressure on the existing facilities. Also, the health workers are in conflict with the state government. The COVID infrastructure has to be strengthened and made accessible to the general public. Vivek Karindalam joining us live. Vivek, the situation is grim, and interestingly, Kerala initially won all the praise and accolades for fighting COVID in a way that no other state did. From that position to this, what went wrong?
Exactly. Initially, during the initial days, if you look at especially the month of March and April, yes, the state was, featuring better when it comes to health management, especially controlling, the COVID-19 crisis. But now, as of now, the state is, facing a massive pressure, especially, there is infrastructure. The problem is the manpower is very, very less. Also, there is a tussle between the government and the health officials. Remember, 3 days back, a senior doctor called Dr. Aruna and two head nurses were suspended. And then the doctors were under protest, especially all the medical nodal officers in all medical colleges were protesting against the government decision. Also, we need to understand the number of the test positivity rate between September 26th and October 3rd was 13.7%, which is the highest in the country. And also the number of cases per million, it has reached 2,249. Now, this is the highest among, among other states, especially in Kerala. Remember, initially, the state had managed to control the cases in a very good manner, and also it had won accolades from various quarters, not just from the country, but across, other part of the world also. But the problem is, the manpower is becoming a major, major problem. And also we know that Kerala is a state where it's a thickly dense population. The density of population is very, very high as compared to other states. Also, the number of returnees, Gulf returnees and returnees from other states are very, very high. The expatriate population, the NRI population is very high in Kerala as far as other states are concerned. Hence, the number of people who are returning from other countries, started, coming here in large numbers. And then there was this local spread, especially in the coastal areas of Trivandrum, Ernakulam. If you look at the last 1 week, the figures, it has touched 8,000, 9,000. Last week, for 3 days, continuously crossing the 9,000 figure. And then it was the 8,000 figure. Yesterday, it was a bit less. The testing has also gone high. It has gone up to 63,452. But, the cases have, reduced a bit. It has come down to 7,860. In the meantime, the infrastructure, because if you look at most of the hospitals, the COVID hospitals, the occupancy of patients is also going high. It has gone up to 60 to 70%. And hence, they need more manpower, more nurses, more doctors need to be, made sure that, they are coming to work. So all these things are becoming a major challenge for state health department.
Okay. So immediate challenge, Vivek is telling us, is trained manpower, but of course population density, high number of NRI population and returnees from other states have aggravated the situation. Thanks for joining us with the latest, Vivek.